involved with advancing healthcare was the American Association of Labor Legislation, who drafted legislation targeting the working class and low-income citizens. Under the proposed bill, qualified recipients would see sick pay, maternity benefits, and a death benefit of $50 to cover funeral expenses. The cost of these benefits would be split between states, employers, and employees.
Blacks and other minority groups in the U.S. experience worse outcomes, illness, and premature death compared to whites. Black infant mortality rate was 340 per 1,000, while whites was 217 per 1,000. And now black infants are now twice as likely to die. The data shows that 11.3 per 1,000 black babies die compared to 4.9 per 1,000 white babies. Black women are 3 to 4 times as likely to die from pregnancy-related causes as their white counterparts. Black women have inescapable atmosphere, societal, and systematic racism to create this. Maternal mortality rates in the U.S. have more than doubled over the past 25 years. This trend puts the U.S. in the same category as Afghanistan, Belize, and South Sudan. In fact, the United States is the only developed country with rising mortality rates. Compared to white Americans, the rate of hospitalization for patients with diabetes is 2 times for Latinos and 3 times for African Americans. And for breast cancer patients, African American women have a 50% higher chance of death when compared to white women. Low-income women only get screened 60% of the time when compared to 80% of high-income women. When the women are the same economic level, still white women get higher screening percentages, and 25% of African Americans have elevated blood pressure, while only 10% of whites have elevated blood pressure. Resulting from
heart failure and strokes,
and African Americans experience 40 to 30% worse health outcomes compared to whites. It increases illness, shorter lifespans, and costs in the United States to $60 billion when you add all these up. This injustice feeds to the wealth gap in America by having minorities not being able to pay for these health cares and lowering their chances to getting out of much lower levels of where they are right now. But the organization Black Mamas Matter Alliance out of Atlanta, Georgia provides technical assistance, training, and capability for building these grassroots organizations, maternal care services like clinicals, midwives, doula networks, and community health workers to help foster and help have black women lead to get rid of this. And in this chart, the total is 25% for minorities that have without regular doctor care, while African Americans and Hispanics have a 28 and a 41% when whites only have 19%.
Minority Americans have lower rates of insurance coverage and less access to care. Lack of health insurance is linked to less access to care and more negative care experiences for all Americans. Hispanics and African Americans are more at risk of being uninsured. Nearly one-half of working-age Hispanics, 46%, lacked health insurance for all or part of the year prior to the survey, as did one-third of African Americans. In comparison, one-fifth of whites and Asian Americans ages 18 to 64 lack coverage for all or part of the year. Uninsured minorities are even more likely than uninsured whites to experience problems in obtaining access to health care. Uninsured minorities are more likely than uninsured whites to report little or no choice in their source of health care. Of those uninsured at any point during the year or prior to the survey, 2 of 5 Hispanics, 39%, and African Americans, 38%, and one-third of Asian Americans, 32%, said they had very little or no choice in source of their health care. In contrast, 1 of 4 uninsured whites, 25%, report very little or no choice in source of health care. Minority Americans, whether or not they are insured, are also more likely than whites to be disconnected from the healthcare system and regular sources of care, both important indicators of quality care. Minority adults are less likely than white adults to have a regular doctor. Just over half of all Hispanics, 57%, said they have a regular doctor, as did 68% of Asian Americans and 70% of African Americans. In contrast, 4/5 of white, 80%, reported having a regular doctor. African American, 13%, and Hispanic adults, 14%, were more than twice as likely as white adults, 6%, to report no regular source of care.
Past drug epidemics also tells the story. During the 1970s and 80s, federal and state lawmakers reacted to the heroin and crack cocaine epidemics of those times with punitive, tough-on-crime policies, including the launch of the war on drugs. And those older epidemics primarily hurt lower-class, minority groups in urban areas, not the middle-class and wealthier white people in rural and suburban places, mostly hurt by the opioid epidemic of today. To be clear, the doctors' stated fears that black patients are more likely to illegally sell and get addicted to drugs are based on false stereotypes. The research shows black people aren't more likely than their white counterparts to use or sell illicit drugs.
There are many negative aspects of today's healthcare. Breakthroughs in information gathering, research, treatments, and communication have given medical providers new tools to work with and fresh ways to practice medicine. For example, the internet has become a main source of medical information. In fact, according to the Pew Internet and American